Hello, I'm David Parry, CEO of SSP Health, and I'd like to look back on a year that we will never forget. The COVID-19 pandemic touched all aspects of our lives, and more so for those of us who work within the National Health Service. As well as the grief, frustration, uncertainty, and exhaustion, we've also experienced a huge sense of camaraderie, achievement, pride at how we're all getting through this together as Team SSP, and continue to provide excellent healthcare for our patients. But before looking back at our achievements, I'd first like to thank every one of you across SSP Health, from our clinical and admin teams in practices throughout the Northwest to our head office colleagues. Thank you for all you have done and all you are doing during the pandemic in extremely challenging circumstances. You have all shown great resilience that was born in the processes, frameworks, relationships, methods that SSP Health has created over many years to ensure that our GP practices achieve so much more by working together than they could ever have done working alone. And I must add that resilience is also due to the wonderful staff who work in our organisation, people who come to work each day wanting to make a difference to the lives of our patients, people who also look out for each other. And so, at the end of February, faced with the terrifying spread of coronavirus around the globe and into our communities, our teams acted with agility, with focus, with bravery, and ensured that our patients could continue to access the healthcare they needed without spreading the virus. This meant that in a few short, intense weeks, we moved from 90% of patients being seen face-to-face to 90% being treated remotely, either by telephone or by video call. And we continued to hit our very high NHS quality targets. It meant our reception staff embracing total triage, giving patients the reassurances that their problem could be dealt with successfully by clinicians, but in a different way that kept them and their families safe from a disease which was claiming more and more lives each day. It also meant being understanding when patients felt upset or worried and soaking up both frustration and gratitude with equal good grace. The already very high cleanliness standards within our surgeries had to be taken to a new level, and we all had a role to play in that. We learned to live with visors, gloves, masks and scrubs, and how to smile with our eyes. Some of our practices had to physically move out of the surgeries they called home to make way for COVID clinics, sometimes having to shift their operations to new sites with little notice over just a few days. That meant teams working together, learning together, supporting each other along the way. We brought in welfare checks for patient shielding at home, our isolation champions making call after call to ensure that those vulnerable members of our communities were not left behind and were getting the help that they needed, physically, mentally and socially. Many of our colleagues, especially those at head office, had to establish their workplaces at home, not only getting their cameras, microphones and speakers in working order, but also ensuring that the streamlined processes that SSP Health uses to keep the practices functioning efficiently were effectively transferred to remote networks organised via video conferencing and instant messaging conversations. Our managers worked very closely with the NHS and with CCGs to bring in online consultation that kept patients safe in their homes but gave them access to advice and their surgery 24 hours a day, 7 days a week. We have all found new ways to communicate, connect and deepen our ties to each other and ensure that all of our colleagues were updated and involved, and with our patients too, urging them to contact us with their health concerns despite the pandemic. We have had to cope with our staff having to self-isolate or becoming ill with the virus themselves, especially during the second wave of COVID-19, when many areas covered by our practices were so hard hit by the virus. This has meant juggling rotas, staff taking on new roles, helping out where needed, risk assessments for our vulnerable colleagues, and covering for others at short notice, even in practices which joined us during the pandemic. But despite this huge and rapid change, we all handled it with professionalism, with dedication, with pragmatism, and of course, with good humour. Many of our clinicians, who thrived on personal contact with their patients, found new ways to connect with them, showing great adaptability in how they delivered their excellent care, and admin teams took on greater responsibilities with maturity, with flexibility. We also had success in awards, held online events, raised money for charity, clapped for our colleagues and celebrated milestones. What sustained us in a continually unfolding situation was the overwhelming gratitude of our patients, the national outpouring of pride in the NHS, local businesses that gave us donations that kept us smiling. Then there were the offers of masks, hair ties, headbands from people we didn't know, the colourful scrubs from people we did within our own organisation, a kind message from a colleague or manager, and the paintings of rainbows from children. Over recent weeks, we've been involved in the planning and initial delivery of the COVID-19 vaccines that will eventually bring back our way of life. GP practices again at the heart of keeping our nation safe and well. Next year, we will have the challenge of giving even more vaccine, as well as the normalisation of all of the other health treatments, checks, screenings that kept us so busy before we have even heard of COVID-19. But we know that we'll not only get through this, we will excel as an organisation if we continue to draw on your phenomenal efforts, your compassion, your commitment. This Christmas, though it may be difficult, I hope that you can take time to relax, reflect and spend time with the loved ones that you're allowed to be close to, and have virtual get-togethers with the ones that you are not. 2020 has seen the biggest health crisis for 100 years, but we can look back on a tremendous job well done for our patients, for our communities, in the knowledge that we can handle anything that is still to come. And so, on behalf of Dr. Shikha Patalia, Dr. Sanjay Patalia and myself, thank you so much for your efforts this year. Thank you for your professionalism, your commitment, your determination and your good humour. Merry Christmas and a Happy New Year to you all.